Hello, my friends, and welcome back to Golden Age Health. I am your senior medical guide here, and today we are going to talk about one of the most important and often misunderstood topics in medicine for people over 70. Many of you are told that certain tests are mandatory once you reach a particular birthday, as if the calendar alone should decide what happens to your body. Yet growing research in older adults shows that some routine tests may bring little benefit, and in some cases can increase your risk of complications and loss of independence. In this conversation, we will look carefully at 3 common tests that many doctors still order automatically, even for healthy, active seniors with no symptoms. The purpose is not to frighten you or tell you to reject medical care. The purpose is to give you calm, clear information so you can ask better questions, understand the balance between benefit and risk, and work with your own doctor as a partner. Whether you are approaching 70, already past it, or caring for aging parents, this knowledge can help protect both the quality and the length of life for you and those you love. Here is the uncomfortable truth that Golden Age Health wants you to understand gently but honestly. There are 3 particular tests that doctors frequently label as essential for everyone over 70, even when you feel well and have had normal results in the past. In recent years, major medical organizations and large research studies have quietly shifted their recommendations, warning that these tests can lead to overdiagnosis, overtreatment, and serious complications. More tests do not always mean better health, especially in later life. Now, let me describe a situation that Golden Age Health hears again and again from viewers around the world. A patient, let us call her a 73-year-old grandmother, feels wonderful. She walks every day, cooks for her family, sleeps well, and has no worrisome symptoms. Yet at her checkup, she is told she now must schedule a colonoscopy, more aggressive cancer screening, and a heart stress test, simply because she has crossed an age line. She has also heard stories from friends who had complications after these tests, including bleeding, infection, and hospital stays that left them weaker than before. She sits in the car afterward thinking, "I feel fine. Why am I being pushed into so many procedures? Is there something my doctor is not explaining about the risks and benefits at my age?" A similar scene plays out when adult children bring their 78-year-old father or mother to the clinic. The parent is doing reasonably well, maybe with a few mild aches, but living independently, while the son or daughter hears about a long list of tests that sound frightening and urgent. The family wants to protect their loved one, but they also do not want to refuse something truly important. This tension between fear of missing a serious disease and fear of being harmed by unnecessary procedures is exactly why we are having this careful discussion. You deserve clear explanations, not automatic orders. To understand why Golden Age Health is urging you to pause and think, we need to talk about how medical screening changes after about age 70. Screening tests were originally designed for groups of people where, on average, the benefits clearly outweigh the risks over many years. In middle age, you often have a long enough life expectancy for a slow-growing cancer or a developing heart problem to be found early and treated before it truly threatens your life. The situation becomes very different in your 70s and 80s. Your remaining life expectancy is shorter. Many diseases progress more slowly than people realize, and your body usually recovers more slowly from anesthesia, bleeding, infection, and hospital stays. At the same time, conditions like high blood pressure, diabetes, kidney disease, or simple frailty can greatly magnify the dangers of invasive procedures. This means that protocols written with a healthy 50-year-old in mind can actually become harmful when they are copied and pasted onto a healthy 75-year-old. The risk side of the equation grows larger, while the potential benefit often shrinks. That is why more and more expert groups now emphasize something called shared decision-making, where you and your doctor look at your age, health, and values together instead of blindly following automatic rules. In the next parts, we will apply this thinking to 3 specific tests. Let us begin with the first so-called mandatory test, routine colonoscopy screening in otherwise healthy seniors who have already had normal examinations in the past. At Golden Age Health, we see many older adults who are surprised to learn that major guideline groups no longer advise repeating colonoscopies again and again into the late 70s for people with no symptoms and no high-risk findings. A colonoscopy is not a simple blood test. It requires a powerful bowel cleansing preparation, fasting, sedation, and the insertion of a long, flexible camera into the colon. In younger adults, the risks are usually low. In people over 70, especially over 75, those risks climb steadily. Dehydration from the bowel prep can disturb salts in the blood, trigger confusion, or worsen heart and kidney problems. Sedation can lower blood pressure, slow breathing, and increase the chance of delirium and falls in the days after the procedure. The wall of the intestine becomes more delicate with age, and the risk of tearing or serious bleeding, while still not common, is clearly higher in older bodies than in younger ones. At the same time, colon cancer usually grows slowly. If your colonoscopy at 60 or 65 was normal, it often takes many years, sometimes a decade or more, for a new polyp to become dangerous. For many healthy older adults, the odds of dying from something else, such as heart disease, stroke, infection, or frailty, are higher than the chance that a new colon cancer will appear and progress far enough to harm them. The important exception is symptoms. If you notice blood in the stool, a persistent change in bowel habits, unexplained weight loss, or ongoing abdominal pain, then a diagnostic colonoscopy may be very appropriate and timely. Doctor's golden tip: know what is normal for your bowels. And if something clearly changes for several weeks, speak with your doctor promptly. Screening when you feel well is optional. Investigating symptoms is not. Now let us turn to the second so-called mandatory test, the prostate-specific antigen, or PSA, blood test for men over 70 who feel well and have no urinary symptoms. For many years, PSA screening was promoted as a way to save lives from prostate cancer. The test is easy to order, and when the number comes back even slightly elevated, it often triggers a chain of repeat blood tests, scans, biopsies, and sometimes surgery or radiation. Large studies and years of experience now show that in older men, this chain of events can cause more harm than benefit. Prostate cancer behaves differently from many other cancers. When doctors examine the prostates of men who have died from other causes, many men over 70 are found to have tiny, slow-growing clusters of cancer cells that never cause trouble in life. A PSA test, however, cannot reliably tell the difference between a tiny harmless focus and an aggressive tumor. Any raised result can create alarm and urgency, even when there is no immediate danger. If the number is high, the next step is usually a biopsy, where needles are passed through the rectum into the prostate to collect samples. In older men, the risk of serious infection, bleeding, and hospitalization is higher than in younger patients. When cancer cells are found, many men feel pushed toward aggressive treatment, fearing that doing nothing is reckless, even if their cancer appears slow growing. Surgery and radiation can lead to urinary leakage, erectile dysfunction, and chronic pelvic pain, all of which can sharply reduce quality of life without clearly extending it in a man already in his 70s. For these reasons, many guideline groups now advise against routine PSA screening after about age 70 in men with no symptoms and average risk. Some healthy men with longer life expectancy or strong family history may still choose careful monitoring, often called active surveillance, rather than rushing into treatment. Doctor's golden tip: before you agree to a PSA test in your 70s, ask your doctor what the plan will be if the number is slightly high, and whether a period of watching and repeating the test might be safer than going straight to invasive procedures. The third test that is often presented as routine for older adults is the cardiac stress test, done even when you have no chest pain, no unusual shortness of breath, and no change in your daily stamina. At Golden Age Health, we frequently hear from viewers who were sent for a just-to-be-safe stress test before surgery, or simply because they turned 70, despite feeling stable and active. A stress test usually means walking on a treadmill or receiving a medication that makes your heart beat faster, while your heart rhythm and sometimes images are recorded. In younger, high-risk patients with symptoms, this information can be helpful. In symptom-free seniors, the balance often tilts toward harm. First, the test itself puts deliberate strain on your heart. For frail, older adults or those with severe underlying disease, this can occasionally provoke chest pain, dangerous rhythm changes, or even a heart attack. Second, stress tests in seniors have a high rate of false positives, results that look abnormal but do not reflect a truly dangerous blockage. These findings often lead to urgent referrals for cardiac catheterization, where dye and thin tubes are threaded into the heart arteries through the groin or wrist. That procedure, in turn, may uncover a moderate narrowing that might never have caused trouble in the years ahead, yet a stent is placed just in case, followed by blood thinners and the ongoing risk of bleeding, bruising, and additional hospital visits. Meanwhile, for most older adults without symptoms, the best protection for the heart comes from steady blood pressure control, managing cholesterol and diabetes, not smoking, staying active, and promptly reporting any new chest discomfort or breathlessness. Many cardiology experts now discourage routine screening stress tests in people who feel well and can walk comfortably without limitation. Doctor's golden tip: if you can climb a flight of stairs at your normal pace without chest pain or severe breathlessness, that everyday performance often tells your doctor more about your heart than a one-time just-in-case stress test. Now, I want to share a story that Golden Age Health has seen many times with one patient we will call Margaret. At 76, she lived on her own, walked most days, cooked her meals, and helped with her grandchildren. Her colonoscopy at 65 had been normal, her heart had given no trouble, and she had no bleeding or urinary symptoms. At a routine visit, she was handed a list: another colonoscopy, a PSA test for her husband just to be sure, and a cardiac stress test for both of them. It was described as routine for their age. Margaret nodded politely, but on the way home she said, "We feel fine. Why are we doing all this?" When we sat down together, we looked at what the evidence and guidelines say for people in their late 70s who feel well and have had normal previous tests. We weighed the small chance of discovering a dangerous problem against the very real risks of dehydration, perforation, infection, bleeding, and a long weakening recovery if something went wrong. Margaret and her husband realized that their main priority was staying on their feet and in their own home, not collecting more procedures and hospital numbers. With this in mind, and together with their doctor, they chose to decline those routine screenings and to focus instead on daily walking, a few strength exercises each week, a Mediterranean-style eating pattern, and careful control of blood pressure and cholesterol. Several years later, they were still living independently and enjoying family visits. Doctor's golden tip: before you agree to a test, ask whether it truly protects your independence or mainly adds more appointments to your calendar. By now, you may be wondering whether this cautious approach from Golden Age Health is just opinion or whether there is strong research behind it. It is important to say clearly that these concerns do not come from being against tests, but from what large studies in older adults have actually shown. When researchers have followed groups of people in their 70s and 80s over many years, comparing those who continued aggressive screening with those who stopped after previous normal results, the pattern is often the same. There is little or no improvement in overall survival for the heavily screened group, yet there is a clear rise in complications from the procedures themselves, including hospitalizations, weakness, and loss of independence. This is why many medical societies now support initiatives such as the Choosing Wisely campaign, which publicly lists tests that are frequently overused in seniors. Doctor's golden tip: when a new test is suggested, calmly ask whether guidelines recommend it routinely for someone your age, or only in selected cases with specific risk factors or symptoms. At this point, you may be asking how an ordinary person can sort through all of these choices without a medical degree. Golden Age Health suggests 4 simple questions that you can carry with you to every appointment after the age of 70. First, ask, given my age, current health, and previous test results, what is the real chance that this test will find something that could seriously shorten my life in the next few years? Second, ask, what are the concrete risks of this test and any follow-up procedures it might set in motion? And how often do those complications happen in people my age? Third, ask, if the result is abnormal, exactly what would we do differently? And how likely is that treatment to improve my quality or length of life? And fourth, ask, what do current guidelines from major medical organizations say about this test for someone like me? Doctor's golden tip: if your doctor answers these questions clearly and patiently, you are in good hands. So, if aggressive screening is not always the best answer, what should healthy seniors focus on instead? At Golden Age Health, we encourage you to put your time and energy into habits that consistently show real benefit for people in their 70s and 80s. Regular movement, such as daily walking and simple strength work with bands or light weights, protects your heart, brain, and bones. A diet rich in vegetables, fruits, whole grains, beans, and good protein supports muscle, immunity, and digestion. Staying socially connected, learning new skills, and caring for your sleep and mood all help preserve independence. Doctor's golden tip: schedule your walks, meals, and calls with the same seriousness you once gave to important meetings. As we come to the end of this conversation, Golden Age Health wants to leave you with a hopeful message. Saying no to certain routine tests after 70 does not mean giving up on your health. In many ways, it means choosing a wiser, more focused way of protecting your precious strength, independence, and time. The real foundation of healthy aging is built every day, not just in a clinic or hospital, but in your kitchen, your living room, your neighborhood, and in the small choices you make from morning to night. Think of your health support as two strong pillars. The first pillar is your daily lifestyle. A colorful plate with vegetables, fruits, whole grains, beans, nuts, and enough protein helps your heart, brain, and muscles work smoothly. Many seniors benefit from foods that support circulation and muscle health, such as leafy greens, berries, and sources of omega-3 fats like fish, walnuts, or flaxseed. Simple leg and balance exercises protect you from falls, while regular walking keeps your arteries more flexible and your mood more stable. Good sleep, gentle stretching, and calming routines before bed give your body time to repair itself. The second pillar is careful, individualized medical care. That includes check-in with your doctor about whether you need supplements like vitamin D, B12, or omega-3s, especially if blood tests show low levels or your diet is limited. It also includes a yearly review of your medication list to remove drugs you no longer need, simplify your schedule, and reduce side effects that can cause dizziness, confusion, or falls. When new symptoms appear, seeking timely professional help is essential. Thoughtful medicine and appropriate testing still save lives every day. Doctor's Golden Tip. After 70, the goal is not to chase every possible test, but to build a life where your energy, clarity, and independence are protected as much as possible. Use tests wisely, cherish your daily habits, and always work in partnership with a trusted healthcare professional who understands your values and your dreams for the years ahead.